I know what we're doing with the pandemic, and you see the reaction to that in order to save lives. Is it very frustrating from your end when you see the reaction to something like that, which we know the ramifications of the pandemic, and unfortunately we've had lives lost. But I sit back knowing the job and the message of what you're trying to achieve and how many Australians each day, unfortunately, do take their lives. So if you then added that up in the last little period, does it frustrate the hell out of you that we don't have the same reaction to what you do?
That's a really interesting question that you ask, Corey, because that's something that I think about a lot every day. It's something that I've thought about a lot for many years. And you know, COVID-19 has infected a lot of people. And tragically, we've lost about 63 or 65 people as a result of this. Now, every one of those people is a family member, and there's a story to that. So it's important that people don't interpret this the wrong way, but that's 63 or 65 lives lost. And that's tragic and devastating for the families and the friends and the communities that have to come to terms with the loss of a loved one. And I absolutely understand that, and I absolutely support that. But one of the things that does frustrate me is that as a country individually and as an entire population, we have completely shut things down almost overnight and instantaneously to protect lives. And I understand the thinking, the rationale behind that, and we all have a responsibility in that. But to give this some perspective, we've lost 60 odd lives. Every day in Australia before COVID-19, on average, we lose 8 people a day to suicide. So that's 56 lives lost every week on average. 52 weeks a year. We've had 3 consecutive years in Australia, 16, 17, 18, where we've lost more than 3,000 people to suicide every year in Australia. We're at an all-time high with the number of people that have tragically taken their lives. And then to give it some more perspective, on average, we have 65,500 people who are attempting to end their lives every year in Australia. We've never had a response or a reaction from our governments on both sides, our businesses and our communities, and individually. We've never had a reaction or a response to protect and preserve the lives lost because of mental health conditions. And my great fear is, and I hope I'm horribly wrong with this, Corey, but my great fear is because of the exponential explosion in stress and anxiety and uncertainty and loss of job and loss of income, that we run the real risk of having more people or losing more people as a result of mental health conditions and not feeling like they can find a way through that. So yes, it does answer the question, is the short answer. Do I think that things will change? I'm not sure. I wish and I hope that things do change. But if this is what we're capable of because of a contagious virus, and why aren't we capable of responding in the same way to protect and preserve lives of people who are living with mental health conditions? I don't get it.